Hello everyone, Leslie Cornwell here with Midwifery Business Consultation. Today's course, Birth Assistant, is really near and dear to my heart because having a birth assistant at a birth center delivery, a home birth, is invaluable. Midwife cannot give successful, safe care without having that right-hand man woman with us. So a birth assistant is someone that we could train on site. We could have them do a course like the one I'm doing now, or the American Association of Birth Center has an online partial distance program for birth centers, relatively new. I think the challenge with that is you have to go to a local place to do the on-site drills. So my online course about birth assisting is to help with the training of the critical skills, the hand washing, the HIPAA, all the things a birth assistant should know. And then the midwife can now do the on-site training, the drills, the simulations, the direct orientation process. So this course is about 8 hours. It should take a birth assistant to do. There's a lot of great educational handouts attached, and then just look over the courses. So my goal was to train a birth assistant, whether they've been a doula for years, they're going to be a midwife apprentice, or this is their first birth they're going to see. My goal was to create a good framework so that that birth assistant is better prepared for that first birth experience. So some of the things in the course includes labor support, emergency situations, newborn resuscitation, postpartum hemorrhage, regulatory things, hand washing, personal protective equipment, things that we want to keep our staff safe, on top of great support for the women. So let's dive into what is the role of a midwife birth assistant responsibility. I know there's a lot of confusion of what is a doula, what is a birth assistant, what is a midwife apprentice, and what is a midwife. What are all those roles? Each practice is going to make their own job description, but this is from my personal experience. A doula strictly labor supports. They don't have any medical skills. They're not going to help in an emergency situation. They are strictly a person that is very valuable for helping a mom through the stages of labor and birthing her baby. A midwife apprentice is specifically there to train to learn the midwife's role. They can assist, but that's not their primary responsibility. Their responsibility is to learn and get as much experience from how the midwife's clinical care thinking process is. A birth assistant is there, they're going to learn, they're going to get experience from the midwife, but their primary purpose is to assist the midwife, be the second hand at the birth, tag team doing responsibilities of a long labor, taking rest, getting a little bit of breaks, being that second hand when the baby is being born. So if there is any complications with mom and baby, you've got two skilled people. I strongly encourage your birth assistants to have newborn resuscitation training, BLS, stable, PALS. Look into those certifications in your area. Every state does have different rules. Like California has regulations of what a birth assistant could be. Massachusetts has regulations that it has to be a 1-year experienced labor and delivery nurse or a midwife. So you have to know your state regulations. Most states don't specify the background education needed to be a birth assistant. It's more on the job training. So my goal with this course is to help midwives train their birth assistants, because I know they're very, very busy. And so I took my 1-day on-site course I did in my area for the midwives and turned it into an online course. We look forward to seeing you at the future videos. We're doing many one for our birth midwifery business consultation company. But if there's anything you guys have suggestions of wanting courses on, please don't hesitate to send me a message.